delighted to be here this afternoon. It's I always find these events slightly strange when I really have got no idea now who I'm talking to, because I can see there's a number of people here, but we have no feel for you know, who you are, where you're up to, and what's going on for you. So we're going to run through these 3 presentations today, with myself as a farm vet, with Brad as an equine vet, and with Issa as an educator. And we've left plenty of time in that for us to have some chat afterwards, and we hope we're able to you know, to answer any questions that you've got in the time that we've got available to us. So you know, the presentations are quite short, but by the same token, you know, I've got the chat open, so if there's anything that comes up during my session, please put it in, and otherwise you know, I say Issa and Brad, I'm sure will feel the same when they're delivering their presentations shortly. So let me begin. So as I say, I'm a farm vet by trade, if you like, but at the moment I'm the president of the British Veterinary Association, which we'll come on to talk a little bit about what that does and why I think that's helpful for us as a profession later on. But you know, like many vets, my aspirations to become a vet started really quite young. So the picture on the left there is me standing in the back garden of our house in Buckley, where I was born in North Wales. And apparently one of my first words was cow, and I think that sort of set the scene really for what I was going to go on to do with my veterinary career. By the time I was the schoolboy, you can see sitting in the front row there, I've circled myself in the front row there at Kingsway High School in Chester in the mid-1990s. I was pretty convinced by that point that I wanted to be a vet. But what I wanted to highlight to you is, you know, this school here was a sort of inner city Chester school, where we had a huge range of different people there. And as I look around some of the faces surrounding me there, I can see people who've gone on to all sorts of different careers. There's a barrister stood behind me. There's a researcher for a parliamentarian sat a couple of places away from me. A doctor sat in there as well. But also I can see 2 lads who I know went off to join the army, and I can see a couple of the people behind me I know went into teaching. Just a huge range of careers came out of that school, and it certainly wasn't an educational environment that was steeped in history, I suppose, of sending people off to veterinary college. As far as I know, I was only the 2nd person from that school to end up at a vet college. And I was very fortunate growing up in Chester, because it's a relatively small city and it's surrounded by farmland in Cheshire. So, you know, from the age of about 12, I was able to get myself out onto farms, you know, enjoying lambing sheep and getting involved in milking cows and so on and so forth. But I recognise that depending where you are in the country or where you are in the world, that might not be a possibility for you. And I know one of the questions we regularly get asked by people wanting to come forward to be a vet is, that, you know, I live in a city, how can I possibly get some farm experience? And I absolutely accept that that is challenging. But what I would point you towards would be things like the city farms that we've got, the petting zoo type events that we've got in cities as well, as being really nice examples of where there is a variety of animals, which I'm sure most owners would be very happy for you to go and muck in, quite literally, in helping out with those animals, whether it's feeding, bedding, whatever. And that experience is invaluable, really, in just understanding how to be around those animals. The other reason that I put my school photo up on there is I think it's important to recognise that, you know, you perhaps go into a veterinary career thinking that you're going to have a career of working with animals. Not an unrealistic expectation, but actually it's about working with people as well. At least, you know, a hugely bigger half of our job, I would suggest, is spent talking with people and engaging with people. And hence my my photo of my lovely cohort from school there. And for me, that's something that I would be thinking about as well. If I was looking today at a career in being a vet, be thinking, what is it that I can bring to the party when it comes to my ability to relate to other people, and are there any areas of that I might need to develop and to work on before I think about going off to university as well, because I'm sure that will come up in any kind of interview process at that stage. But I know that others are here to talk about education, so I'm going to jump straight back into being a farm vet. And the picture on the left there I put in to remind me of the absolute truism of being a clinical farm vet, by which I mean a vet who works in practice and goes out and sees animals on a daily basis. And there is an absolute truism there that we never go outside in nice weather. As soon as the weather gets nice, farmers jump in their tractors and start making silage or hay or baling the latest crop or whatever it might be. So a huge amount of our work is outdoors, and a huge amount of that might be in quite inclement weather. So I think if this is a job that you're interested in, having to think about how you feel about running around in the snow with 2 hats and about 4 coats on a winter's day, makes how you feel about that as a career option, because I think that is a big part of being a clinical farm vet. And of course, we have the other days as well, don't we, where you can see Daisy looking over my shoulder there on a particularly sunny day, and it's just delightful to be out in a field with her in that sort of an environment. But also, the picture on the left there is to remind me of some of the other professions or other opportunities that exist within our profession when you graduate as a vet and you choose to work within the farm animal sphere, because as well as being responsible for those animals on the farm, we're responsible for food safety, and we're responsible for that right through to the point that food is either certified into supermarkets or at least away from warehouses. So really quite a responsible part that we play in the food chain, even when these animals are perhaps now not recognizable as animals because they're perhaps processed into something completely different. And the reason I mention that is just to highlight one of the many strands that I think become open to you if you are a member of the Royal College of Veterinary Surgeons and MRCVS. In that, clinical practice, of course, is what a lot of people think of first when they think about being a vet, but it's not the be all and end all. And that's certainly not what I would suggest you made your only aspiration if you were thinking about being a vet. The picture on the right hand side there is the 4 of us around the edges, if you like, of that picture, are the 4 partners at McMurtry and Harding before I left a couple of years ago. And it's a lovely picture. It means an awful lot to me because the 2 gentlemen in the middle there are the original McMurtry and Harding. And the reason I put this up is to remind me that working in practice, roughly half of practices at the moment are still independently owned and are small businesses. The other half are owned by bigger corporates who perhaps are, are not vets at the very top of them, but are run in just a slightly different way. And I'm not here to make a case for one or the other, really. I'm simply here to point out that there's yet more variation, really, in people's career structures through veterinary practice than I think ever there was before. A really exciting time to be involved in that area of work. I said I would come back to BVA, to the British Veterinary Association, and here again, another opportunity to do something different with my MRCVS. So right now, I'm involved in helping to shape and deliver policy and deliver guidance for our profession, and also to lobby government at very often the highest levels about animal health and welfare and where we see that vets should be fitting within that whole picture. So a big topic on our agenda at the moment, of course, is Brexit, and thinking about how that's going to impact our ability to trade with European nations and further afield after the 1st of January, and what vets need to do, how we need to be prepared for the changes that are inevitably going to come as part of that. And well, I find that very exciting. I realise it's not for everybody, but I find that very exciting to be involved at that level, thinking on a day-to-day basis about things which have an impact beyond the individual animal, beyond the individual farm, and indeed beyond the individual vet. But I think that's quite the point where I would like to draw this to a close, is thinking that as a farm animal clinical vet, and I'm going to be that specific, having just hopefully highlighted the different opportunities that are available, but as a farm animal clinical vet, I think one of the biggest things that I can take from that is the important position that you will play in a rural community, working alongside your clients. Many of them will become friends over time, and it's just a wonderful privilege to have that opportunity. And I would absolutely extol any of you to think about that as a future career. Thank you. Are you able to come off mute, Brad?
Yeah, thanks, James. I'm just going to load my presentation.
Brad, have you got a co-star in the screen there with you today?
Yes, I have got a co-star. He's a little bit wriggly, so he may disappear halfway through this. I don't know. Can you see that? Or not quite?
We can see your questions and thank you slide, Brad.
Okay, I wonder how do I get back to the start?
You're moving through them?
Okay. Okay, can you see? Can you see
Absolutely,
that?
you were there, Brad.
Brilliant. Okay, so thanks, James, for kicking things off. I'm going to talk about a day in the life of an equine vet. I'm Brad Hill, and I'm currently a clinical assistant professor, which sounds very fancy, but I work at Nottingham Vet School teaching equine practice across all 5 years. So it's great because I can dip into the whole course and see students the whole way through. So I'm going to start by talking about my background. So I'm from Wales and I'm passionately Welsh, although I don't sound it. Pembrokeshire is quite an English part of Wales, but okay, Stan's not so happy with this. So my mum was from a farming background, hence the cow. My dad's a businessman and an all-round sportsman. So I often think that I get my drive for success from him. Neither of them had any kind of science background or were involved in any of the medicine, dentistry, or veterinary professions. So it was quite different for me to think about going to veterinary, but I just absolutely loved horses. And Mum always used to say from a very early age, she'd put me in front of the TV to watch the racing, and that would keep me quiet for a whole afternoon, hopefully. So I went through school and I wasn't particularly academic, and I struggled and had a lot of support and help, and then took my A-levels and didn't do so well, didn't get straight A's, but managed to talk my way into a place at the Royal Veterinary College, which is what RVC stands for. And I had an absolutely amazing time. It was a real life experience, having come from West Wales, where we couldn't see another house from where we were. So it was a bit of a culture shock when I was dropped in Camden in the middle of London and suddenly had to find my way. But I met some amazing people, amazing friends. So the top left picture is me in the final year with my 4 rotation buddies. So when you're in the final year of the vet course, you go around in a group and see all the clinical practices. And that was incredible. So made loads of great friends. I even made it onto the front page of the RVC website, which I'm still proud of, which is a long time ago, but I still like to show that picture. So when I graduated, I knew I wanted to continue my passion for horses. So I managed to get a job in equine practice, but it wasn't a full-time position. So I picked up some small animal work and really continued to do farm, smallies and equine at one stage. And then finally just stuck to equine, and then worked in both an ambulatory setting. So that means out on the road. And also then I actually spent a bit of time in a equine hospital, seeing cases in for surgeries and more complicated, complex workups. Stanley, you're going to sit through this. So back to the day, a typical day in equine practice. So I put this slide together because I thought it'd be interesting just to give you a window and an insight into what goes on. So if you sign up to be an equine vet, you arrive at the practice normally around 8:30, check in with reception, and reception in any practice is basically the heart of the practice. So they tend to dictate what goes on, or certainly try and organize everyone's diary. So it's important to get on well with your receptionist, because they can make your day pretty hectic, or they can send you all around the county, or they can actually make your life a lot easier. So I used to make sure I checked in with reception, had a bit of a natter, got my list of calls for the day, and get the kettle on. And if you were really lucky, you might have a cup of tea or coffee waiting for you. So then you need to load up your car with all your equipment for the day. So we can take an X-ray machine with us. So you can pile that into the car. The X-ray machines now the portable ones are incredible, if not very, very expensive. So you have to carefully put that in your car, not just fling it on the back seat. Maybe take an ultrasound scanner, and also look at your drugs and think, what do you need for that day? What drugs are you going to need to use, and make sure you've got enough of everything. There's nothing more annoying than driving out the car park and then thinking, I wish I just put that in, and then having to drive back. So sorting out your car, because your car is your office when you're an equine vet in practice. Try and touch base with some colleagues regarding any cases that might have come in overnight. Talk about anything that's you need to get some advice on. So it may be a case that day you need to make a bit of a plan and you're not quite sure. There's always someone there to help and exchange information. It's nice in equine practice because often you're working with colleagues that are more experienced than you and maybe less experienced than you, so you can share that knowledge between you all. So jump in the car and away you go. So you normally do 4 to 5 calls in the morning, depending on the distance between them. And then before you know it, it's lunch spot time, and that's Stan. Stan, are you going to actually sit up? Stand out for a wee. That's really, really important. So Stan is my co-driver. He's the dog that sat on my lap. So it's important that he got a bit of a break as well. In the bottom right picture is a lunch spot that would have been particularly desirable if I was in the area, but often you just call into a garage and grab a sandwich. You never really get to sit down for lunch. Often you have to just pick something up and maybe eat it in a lay-by in your car. So you kind of have lunch on the hoof, pardon the pun, and then you go back out and finish off your calls. So you do another 4 to 5 calls, and then back into main base, back into the practice. And then you need to write everything down that you've done that day, and make sure you do your own billing. And if you don't do that correctly, then someone will be on your back saying that you missed something. So there is a fair amount of paperwork, so you do need to keep on up to date with that. But actually, it's quite a nice time to reflect about the cases that you've seen that day, and make sure you document everything, so that if someone else had to go out and see that horse, they could pick up where you left off. So if you're on call, so I used to be on call one night in the week and maybe one weekend a month. So that's where you have to then have the phone by your side. And if it goes off at any time during the night, then you need to be ready to go. So you need to make sure that there may be some messages or cases that have been going on during that day that you didn't know about that will need monitoring overnight. Again, make sure you've got everything in your car, because when that phone goes and you're back home tucked up in your bed, you need to jump in that car and get out to the emergency and not have to go back to the practice. So another time to just make sure that you've got everything you need. So I just thought I'd talk through a case just to give everyone a bit of a taste for what we might have to see when we talk about these calls that we go to. So these horses that we see, So this would be Misty. Misty developed a problem with her feet, so she ate quite a lot of grass and was allowed to put on quite a lot of weight, which caused a condition called laminitis, which is a condition that affects the feet. We see this quite commonly. So Misty is of a breed where she's designed to be on the Welsh hills and not on beautiful pasture land. A lot of these ponies are kept in a perfect paddock with lots of grass, which doesn't suit them. So they end up with sore feet, and the bone of the foot, which you can see in the X-ray image. So that's an image that we take to look at the bone. So that's an X-ray. You can see that actually that bone is slightly tipped away from the front of the hoof wall. So this is the front of the hoof wall, and the bone is actually rotated away. So Misty needed a bit of help to sort out the pain in her feet. So we had to get the farrier in, and that's the other picture, to put on a special shoe. Misty had to go on a diet, so she had to come in out of that lush paddock and have some hay, and that hay needed to be weighed. And I put that final picture in the bottom left corner saying team, because often these patients that we treat, it's all about the team. So it's the farrier, it's the owner. So the owner needs to be on board with weighing out Misty's hay and making sure that those calories are reduced. And you need to be there leading that team. So that's very much what it's about when you're out in equine practice. It's about being able to communicate to others so that you can do the best job for your patient. And I'm glad to say that Misty did lose a fair amount of weight, and her painful feet were resolved, and she went back out into a paddock, albeit a smaller one than she was in before. So she didn't quite have as much grass. So what are the benefits of equine practice life? So there's Stan in his younger days. So you get to spend all day with your dog, often your best companion, your best friend. He gets to sit there on your seat. He doesn't judge you. He just tells you you're amazing, sits there and watches you. And he's just a source of comfort the whole time. So I definitely get a dog. It's equine practice is the only practice apart from farm where you can have that. So that's a top tip. I would definitely say to anyone doing equine, it's essential. So you get lots of time between calls, a bit like farm practice. So you can listen to some podcasts. There's a podcast there called How to Fail, which is all about actually failing forward and what we can do to reflect on things that we think were a failure, but actually probably shaped us and helped us move forward. And you can communicate with a great team around you. So you have your vets, your nurses. I've talked about reception, and you can learn something from everyone. So you meet lots of people from lots of walks of life, and it's great to catch up with them and get to know them. So I put the picture of a garden because I spent quite a lot of my time when I was out on calls, drinking tea, eating cake, and wandering around these beautiful gardens that I came across. So you can generate interest between your calls and actually learn lots of different things that you didn't know. And obviously you can have loads and loads of fun. There's some great stories that I could tell. It's an incredible lifestyle. You get the utmost respect from lots of your clients. You really make a huge difference. And the horses are just amazing. So I would encourage all of you to work with horses. I think I might let Stan go because he's a bit wriggly. So where am I now? I'm at Nottingham Vet School. So I stepped out of clinical practice to give back. I was keen to educate the next generation of vets. So there are two pictures with the two horses. I put them up because I teach now equine behaviour. So it's something that we're developing across all vet schools, hopefully. But at Nottingham, I'd like to think we were leading the way. It's really important that we keep up to date with new research and think about animal welfare, because it's important, and it should be important, and we need to teach vets to manage horses correctly and not abuse the trust they put in us. I also sit as part of the equality, diversity and inclusion group. So that's brilliant, and that's something that I'm passionate about as well. welcoming everyone into the profession from every single background. There's no set identity when you become a vet. You can be exactly who you want to be, and go out there and be the best vet you can. So we welcome everyone at Nottingham into that. And also I work now a little bit with the British Equine Veterinary Association, again, trying to hopefully shape things and direct things and keep things moving forward in a positive way. There's a quote there because that's another string to my bow now at Nottingham Vet School, as we think about how we can adjust ourselves and be a little bit more resilient sometimes in a clinical practice setting. So something else that I'm learning about and teaching and really enjoying as part of my new role at the vet school. So we're going to take questions, I think, at the end of this. Just those two pictures. So working from home now is part of the norm, but I have got two little helpers. I don't sit in the stable, but I do have Minnie on my left in that picture and Dinky on my right. And actually, I couldn't exclude Reggie, who's my other dog, from having his say in this presentation with his 4 legs in the air. And that's how he likes to chill out on the sofa. Brill. Shall stop sharing and we'll take questions at the end.
See if that works. Right.
Yet, I'm afraid, Issa.
Oh, that's annoying.
Just while Issa manages to share her screen, we've been having a read through and chatting behind the scenes here a little bit about the questions that are coming in the chat box. So please do keep those coming, because they're ones that we're going to want to pick up on and chat about a little bit more afterwards. So if any more come in while this is presenting, then please just pop them in there. We're not ignoring them, letting them go up the screen. We are keeping a note of them and making sure we pick up on them at the end.
Ah. So, unfortunately, I don't think my computer is very happy about me sharing my screen. But nevertheless, I don't have a very long presentation. And I think probably getting around to your questions is much more important. But hello, my name is Dr. Issa Robson. I am a farm vet by trade. But in the last couple of years, I have been teaching at Surrey University, and although I really I found my passion and my drive for farm when I was at vet school, I discovered later on that actually the bit that I started to enjoy the most was actually teaching people skills and practical skills. So I'd never have thought of myself as the most academic vet, and I have to say I never thought I would find myself working in academia. I did veterinary as a second degree because I wasn't smart enough from school to get in the first time round, and so I took a bit of a scenic tour into vet school, which was, yeah, in hindsight I appreciated the scenic view and the long way around. I made a lot of good friends at vet school and had a really good time. Yeah, my job now, so as an educator, my day-to-day might look look a bit like this at the moment. So I think that's why all of you are quite interactive in the chat, is because you're probably quite used to kind of like the Zoom meetings. So currently we're trying to keep face-to-face lectures and tutorials to a minimum, and we're trying to just do kind of like the face-to-face practical teaching. So yeah, so I do a lot of kind of sessions with my students through Zoom, and it's actually quite surprising how much practical information you can impart through an online session, but we're managing to do it for our students this year. And other times I will be doing things like showing students how to do a proper clinical exam in sheep and cattle, showing them how to appropriate ways to take blood, and teaching them practical kind of like minor surgical skills. And yeah, and occasionally I get seconded over to small and equine. So whilst I graduated in 2008 and essentially did farm straight out of uni, so I've never really done a great deal of equine or smalls. I think out of all of us, we decided that James had the most small animal experience, having done emergency surgeries on small animals. I'm very much there for the support, and the way we do the roles at Surrey is that you know, we're kind of we're the students' coaches. So we focus a lot on preparing the students kind of like mentally for what can be quite a challenging career. And it can be very you know, it's a profession that I think we have traditionally put a lot on grades and your kind of academic skills, but of course all pets and all animals have owners and farmers attached to them, and actually there's quite a lot of kind of developing your communication and your social skills that goes along with becoming a professional. So that's one of the joys, and I think Nottingham is also very good at this, kind of like with the communication focus. Yeah, and it's something that I joined Surrey in March, and I have pretty much loved every single minute of it. My career in education has led me to lots of different places in the world. So I've been lucky enough to go and give talks in Vietnam and in Thailand, and meeting people from all walks of life in different countries, communicating in languages that are not my first language, has been brilliant. And I find that when I travel and when you meet other vets, you really do see that you're part of a very big global profession, and there is a lot of scope to work elsewhere in the world and not just the UK. One of the things that I also do is I'm a co-founder of the British Veterinary Ethnicity and Diversity Society. So I'm always trying to encourage people who are from non-traditional backgrounds to consider a career in veterinary, vet nursing, but also as a farm vet, to encourage people to think about agriculture as well. Yeah, I think there's been lots of questions, so I think we'll move on to the questions. But you know, my view of why I'm a farm vet is because it makes me really happy, and I really love my clients, and I think that's probably true for a lot of farm vets. Okay, welcome back. Right.
I think there's quite a few questions in the chat there. I think you've been tracking them as well, so you can help yourself to answer them.
So there's lots of questions about you know, kind of like career choices, and you know, like I feel kind of excited for you all, because the world's your oyster and you're trying to choose whether you want to do zoology, conservation, be a vet, be a doctor, and I mean, my take on it is that you can do all of those things whilst being a vet. So your veterinary degree doesn't close off those avenues. It gives you an extra qualification to do them. So yeah, and there's not many professions where you can be the dentist, the surgeon, the GP, the specialist, the researcher, the zoologist, the conservationist, if you want to. And you know, hopefully you'll have a very long career. And you know, certainly my focus has shifted from being in clinical practice to being in education. So yeah, you develop in all of those ways.
I think that's a really fair comment, Issa, and absolutely, hopefully between the three of us, we've demonstrated that there's a huge number of different ways that you can take a veterinary degree, and absolutely, Caitlin will come to that as well, working in the UK or another country, and the opportunities that exist there. But I always think, you know, I had a veterinary nurse who was a zoologist, a veterinary nurse, and one of the things that brought her into veterinary nursing from that very specialized area of working with animals was that she realized that she didn't get to do the bits that I think Issa's just described, and Brad has described, but Issa particularly focusing there on those client relationships, and she didn't get to do that when she was a zoologist. It was very much about study animals and watch the animals and follow the animals, which, you know, for a lot of people that might be exactly what they would like to do. But she recognised that moving into veterinary practice and being part of that veterinary team gave her just a different set of ways, really, of using that degree and using those skills.
Yeah, so yeah, lots of questions about resources for A-level students. Can I ask a question to everybody? How did you, you know, like, did you have supportive school to help you apply to vet school?
Yeah, I can go first. I had a supportive school that probably didn't really get what it was to get into vet school. So that in a way they were supportive, but in a way I don't think they quite understood how demanding it would be. And I wasn't overly academic, but in the end I felt like I had to sort of twist the headmaster's arm in predicting me really good grades. I do remember sitting in his office and saying, look, I really need you to predict these grades, even though I haven't shown that I can achieve them yet. So he did that, and then I got an interview and I got a conditional offer, I think that's what it's called, or on the fact that I got those grades. So I then worked really hard, but yeah, I think it varies in this, but I don't know what James would say about that. Did you have a similar experience, or were you better or worse supported?
I have to be careful what I say because my dad was a teacher at my school, so I need to be very careful how I answer this question, don't I? But look, I mean, I have the unusual accolade that every educational establishment I've ever attended, with the exception of the Royal Veterinary College in London, has closed since I left. So I don't know what that says about me as a student, but I think it perhaps says something. But on a serious note, what I would say is my dyslexia wasn't diagnosed until I failed my first year at university. And the reason I mentioned Dad is he carries a Master's of Education in dyslexia. He was the head of the special needs department at my high school. And right through school, you know, he would be saying to my teachers, James is dyslexic. James is dyslexic. We should be getting him tested. James is dyslexic. And at that time, you know, this was a long way, a lot earlier in our understanding of dyslexia. And, you know, the answers came back from my teachers. Don't be ridiculous. He's doing really well in class. Of course he isn't. And I think that would be the one that I would sort of point to as being a big hurdle for me. You know, I ended up having to resit my A-levels. Even having reset the A-levels, I didn't get the requirements at that point that the RVC wanted from me. But my message, I think, would be just don't give up. I turned up at the open days at the universities. I took every opportunity that they threw at me, and met the right people when I went there, and talked to the people who were involved in admissions and asked them, you know, what else can I do? I'm really determined that this is going to be my career. What else can I do? To the point that, you know, on clearing day for my second round, if you like, of A-levels, I was quite literally sitting at home looking through clearing, thinking about what else I might do. And I got the phone call from the Royal Vet College that morning to say, do you still fancy a place? So, you know, I think that would be my message is don't give up, you know. And what I put in the chat, but I didn't really want to dwell on when I was talking about my BICs. It just felt too much like promoting BVA, really, rather than talking about being a farm vet. But there's a brilliant initiative now which exists between the RCVS, the Royal College of Veterinary Surgeons, and BVA, which is My Vet Futures, or Vet Futures. And I've put the link in the chat box there, but if you simply look for Vet Future Careers, thank you, Issa, My Vet Future Careers, there's a lovely series of resources there for people who are at school, or they're at college, or they're already done a degree and they're thinking of retraining as a vet, whatever stage you might be at, to try and help make sure you've got the support and the resources to be able to do that. So, you know, to go back to the question earlier of somebody saying, should they be learning about TB or whatever, I think it's a really good idea before you approach any interview to have had a bit of a look round what are the agricultural stories and the pet stories and the the animal health stories that are big at the moment. But we don't expect you, and this is from my comment here as somebody who's interviewed at Nottingham and at London, but I look to the other two as being far more experienced. We don't expect you to be a vet coming in and answering those questions. What we like to know is that you've taken a bit of an interest in the world that you'll be coming into, and can perhaps have your own views on, you know, what do you think about badger culling as a way of controlling TB in cattle? What do you think about the concerns we have about antibiotic resistance? And do we think that animals are a cause of that in people? I don't expect you to have the answers. Nobody, I don't think, has got all the answers to those, but to have thought through those things. And I would hope that the My Vet Futures page will guide you towards some of those topics. Issa, I'm sorry I spoke for far too long in that answer.
No, that's fine. I've re-put the links up there for anyone who arrived a little bit later. So the three places that I'm going to signpost everybody to is the My Vet Futures, the Vet Schools Council applications guide, and also there's an online kind of veterinary careers future learn course. And the vet schools currently understand that it's very difficult for kind of pre-vet students to get the work experience. So we're not expecting, as might have been, and you might see these in veterinary forums, to have weeks and weeks of work experience. We know that that is not realistic for some people. You know, if you're not living in a rural community, it's actually very difficult to get farm experience. What we would like to see is that you have an idea of what kind of things you're going to be studying on the course, and what, you know, kind of like what an equine, a traditional equine role looks like, what a traditional farm role looks like, and what it is like working in a clinic. So, you know, once you've got some work experience working in small animal clinics, you kind of hopefully have an idea of what it is that of the career that you're getting yourself into. Everything else is extra. And it's not necessarily how much you have, it's what you got from it. So if we can see that you've paid attention to, you know, kind of like why, if you go lambing, why it's important to get colostrum into lambs, that kind of thing. Like, these are the small things that, you know, you notice the husbandry, you notice the management is a really important component of kind of like animal welfare. These are the things that we're looking for you, not for vast weeks and weeks or trips abroad or anything like that. We understand that that is not, it's not in everybody's capability. So, I'll move on to another question.
Just ask, building on that, Issa, and I wondered if either of you would have a comment from your position within the universities as a year 10 student. You know, where should she go and start doing that now? And I guess it's so variable, isn't it? But
I think that traditionally we've always looked to students that are coming to interview to have done some experience either at kennels or lambing or milking. But obviously during COVID that is difficult, and a lot of these places won't accept students or may indeed be closed. So again, I wouldn't worry about that. I think that a lot of the things that we actually look for, as we've discussed here, is your communication skills. And it may be that you've done some voluntary work, or you've worked as a waiter or a waitress. So anything like that shows that you can work as part of a team, you can communicate, you can have some of those leadership qualities, and that's really important. And I think Issa would agree. We look for that sometimes more than we do having ticked the boxes of actually kind of spending time on a farm or not. I mean, we have students at Nottingham who have never even touched a horse before, and part of what we do now is we actually, and that's why we integrate the equine behavior teaching, is we try and build up those skills so that anyone can work with a horse and be able to read its behavior and actually be confident in getting stuck in and doing everything that you need to do. So we can teach you those skills, and it's something that we're really keen to do at Nottingham. So don't worry if you can't get that hands-on experience, because we'll show you the way. I'm sure Issa would agree with that.
Yeah, I think there's a lot of people who, you know, I'm not from a traditional farm background. You know, kind of, I just grew up in the suburbs, and just when we went on holiday to the countryside, cattle and sheep were fascinating, and just really enjoyed working with them through vet school. And I know there's quite a lot of people who are like me, who, you know, when we don't have, you know, we're not from farming families and we're not from rural communities, but we kind of get caught up in the romance of the countryside, I guess. And, you know, so I think, yeah, something to emphasize is when you come to your interview, you're going to have to talk to us. If you've had a lot of experience of talking to, as if you're a shop assistant, or if you're helping and volunteering, and you have good communication skills, this is brilliant. So, you know, you don't necessarily have to have specific animal related work. I would do things that kind of improve your communication skills. So if you're struggling to find any work in, let's say, a city farm or local farms, if you're having difficulty finding kind of work in equine stables, that kind of thing, then consider kind of those alternatives, which, you know, particularly if they're quite practical. So caring roles and that, I think I would look at that quite favorably. And you're probably going to be quite good at speaking to people. So, yeah. The other thing as well is that, you know, kind of, I was quite 14-year-old. I was quite obsessed with horses, but horses were far too expensive for me to consider. So I became a volunteer at my local Riding for the Disabled, and that gave me a lot of confidence. They taught me how to ride properly. One of our awards for working for the morning was a half-an-hour ride. It wasn't something I could afford otherwise, so it seemed like a pretty good deal at the time. And it meant that not only did I work with the horses, I was working with disabled children and adults, and that has really been a benefit to me and my communication style throughout my lifetime. So.
And I would absolutely echo and support that and say, yes, Caitlin, I think volunteering at a food bank will be something which, if I was interviewing you, I'd be really keen to explore, you know, what communication challenges isn't the word that I'm after, but, you know, but what opportunities had you had for, you know, identifying people's particular needs, for finding out what their reason was for being with you today, for and for helping them to find a solution as well, because I would think that those are all very transferable skills when it comes to actually working through a case, whether you're in practice, whether you're thinking about a research case, whether you're thinking about working in veterinary policy, wherever you end up with an MRCVS, I would have thought those kind of skills are very transferable.
I can see in the chat people talking about kind of like backup courses and things like that. Now, obviously, I think your UCAS form is limited to the number of vet schools that you can put down. I just want to say my school was not supportive. They were very keen to get all of us signed up to a university course so we could fulfill their stats. So they were very discouraging of anybody applying to veterinary medicine, because they viewed it as impossible to get into. So in terms of kind of like your options if you feel that you want to back up because you feel that you might not get the grades the first time round. You know, that, yeah, I resat my A-levels. I did a whole degree to get into vet school. There are lots of different routes now. So please check out the Vet Schools Council's guide, because there's lots of kind of like gateway courses. If you're in Scotland, there'll be, if you're from a widening participation background, there's REACH, and please investigate those kind of alternative routes. Please don't limit yourself to the UK. There are lots of good vet schools in Europe as well, and they usually teach the course in English. And so, you know, this traditional, you've got to get 3 A's to be a vet isn't true anymore. And if you have the determination and you have, you know, you're quite happy to take a bit of time to get there, then there are other routes. But of course, the vet nursing would also love to have you. So it's totally up to you.
Can I just pick up on a couple of little bits that came through earlier? Because I think we looked quite hard at the differences between a veterinary degree and one that perhaps was more zoological conservation-y type thing. But there was a bit in there about human medicine as well, wasn't there? And, you know, I mean, that very much is a sort of horses for courses bit, isn't it? My children will tell you just how brilliant I am at dealing with sick humans. Not is the short answer, and I think that's one big difference, is that very often when you're a vet, you're the human who accompanies the animals. Doesn't tend to be, well, hopefully isn't the patient. I suspect we've all got occasions we can report of being asked to diagnose human diseases as well. But I think perhaps the other differences are in the career structure after graduation, aren't they? And that as a vet, we talk about these day one competencies, which is what the Royal College of Veterinary Surgeons would expect you to have at the time that you come out into practice. That doesn't mean you can do everything. It means that you're somebody who's safe to be able to go out into the world and pick up on whatever strand of veterinary medicine you're going to work with, and be developed and be mentored and trained by the people that you're working with. But that, with some exceptions, there are some postgraduate training courses, but on the whole, that's sort of quite ad hoc. It's done, you know, by a more senior vet in the practice, and it will depend on the caseload and so on and so forth. Whereas I think if you look at that compared to what the medics do, where they come out and they work through this very structured routine of 6 months here, 6 months here, 6 months here. You know, my sister is now a lot of years graduated and is only just about to finish that train really as a consultant in a Liverpool hospital. So it's, you know, I think that perhaps is a difference as well, to think about that, you know, perhaps the more immersive and get on with it with support of your peers that we have in the veterinary field at the moment, perhaps versus more of the structured routine that there might be in the medical field. I say that being aware that I'm further removed from it than either of you two, but so feel free to violently disagree with me.
I mean, like, yeah, I much prefer having cuddly patients. That's it.
Yeah, I would agree. Working with animals is far more fun. You can have cuddles every single day, several times a day. So that was a definite pull for me when I was thinking about applying. And just to pick up what you said, James, I think you're right. In medicine, there's a very structured approach when you graduate, whereas if you do the veterinary course, which we hope some of you will think about doing now, you are kind of out there on your own right from the word go, which is really exciting. You get that responsibility, but there are loads of support within the practice, but different to medicine, you know, you do get to kind of get straight out there and get stuck in with your own clients and patients to treat. So that's probably a big difference.
Oh, in our last couple of minutes on the question, there's been a couple of questions about working abroad. I feel very underqualified to comment on that, having never done so. But have either of you got any?
I mean, I would encourage anybody to spend a bit of time working in another part of the world. I think it expands your mind and heart and everything. yeah, in so many ways that it's definitely worth doing. I just thought I'd bring this is my co-pilot when I'm driving around on farm. This is Piglet.
Oh.
So just come to the road.
Fantastic.
Quite sleepy.
Oh,
Right, thank you very much, speakers, for very informative topics around veterinary care. I think the attendees must have really found it really interesting and informative as well. I think we'll wrap up. There is one more question that's been sent there by Letitia Stevens. Is it easy to work abroad with a UK degree?
Yes, very often you'll find that you need a further qualification when you get there, depending what university you're at and where you end up working. But I think what we can say is that the MRCVS is respected across the world as a great starting point, even if it's not the eventual qualification you need to be in that country.
Thank you very much for answering that question. Just one last question would be, would there be any type of platforms, mediums that these attendees could contact you on if they do have any questions to ask you?
With pleasure. I'm going to put my that's my Twitter handle. If anybody wants to get in touch with me on there, I'll be sure to respond.
Yeah, and I'm just going to put the BVED's Twitter handle. So this is the British Veterinary Ethnicity and Diversity Society. So that's us on Twitter. You can also reach us by our website as well.
yeah, I think I've put something in my bio actually. So if you have a look at that, you can contact me and ask me any questions. So yeah, I'm happy to do that.
Good shout, actually, Brad. I'm sure I did the same, but there we are. We've got bits on there.
Good luck, everybody.
And yeah, I think it's really interesting. So, thank you very much.
Take care, guys. Bye-bye.